What's up? Welcome to your Self-Helpless snack, where we give you a little taste of the Self-Helpless podcast with a mini episode. If you want to dive deeper into this topic, you can find the full episode linked in this episode's description.
For those of you who are struggling with UTIs who are listening, make sure that you check, you get your urine checked with a urine culture to make sure that you're actually finding bacteria in the urine. Because a lot of people don't do that, especially in young, healthy women otherwise. Because I see a lot of people who've gone to urgent care over and over again, or their primary care doctor, gotten multiple rounds of antibiotics, are very much struggling and frustrated. And then no one's ever examined them to find out about their pelvic floor, or even checked a urine culture. Sometimes they'll just check a little dipstick in the office, which doesn't really tell you if you have an infection or not. And then, pelvic floor dysfunction is one of the things that I think is really underdiagnosed in general. It's essentially, the pelvic floor is like a bowl of muscles that sits right underneath our organs. So it holds up our bladder, holds up our rectum, and it helps us in a lot of different ways for moving, postures, holding up those organs, having pregnancies, lots of things, sex. And so it's also very, just like any other muscles in our body, can be subject to stress and tension. And so, like people get TMJ, where they get a really tight jaw and they clench their teeth and then they get headaches, very similarly, stress, anxiety, those sorts of things, or if you've had a recent trauma to the area, or maybe one time you did have a true infection that kind of kicked it off. But those things can cause those muscles to be just tense all the time. And it's as if you did your bicep and you pulled it and you just kept it that way for, you were lifting weights, you just kept it flexed the whole time, it would start really hurting. And because these muscles are underneath all these organs, they can present with a lot of different symptoms. They can present with pain with urination, urinary urgency, like gotta go, going more often than usual. And they can present with constipation, pain with sex, all sorts of different things, and kind of even lower abdominal pain. And so you can very easily confuse it for infection. And it often happens when you're more stressed.
I've been a female my whole life and I never heard about any of this shit. So why do you think that is that we're not educated sooner?
Well, I think one is that women's health has always been a little bit undervalued in society. I mean, if you think about women who have pain with sex, they can't find help or treatment or anything. In fact, some of those codes I can't even bill for, like insurance won't pay for, to see a woman with pain with sex. But a man who has difficulties with erections can get a whole surgery covered to help him get a penile implant.
What the fuck?
So, yeah. And not that I'm mad about men. I mean, everyone should have access to care. But women, absolutely, I think that there's just not enough research in these things. So a lot of people don't even know about it, right? Unless you do a specialized fellowship or you take an interest in it. Like I have colleagues who've gotten really interested in it and never did a fellowship and have read a lot about it. But if you don't look into those things, you won't know about it. So if you ask a regular primary care doctor, I bet you 9 out of 10 of them will not know that what pelvic floor dysfunction really is and what it causes and how can it present. I mean, they may have heard of the term before, but they won't know a lot about how to diagnose it and treat it and things like that. So those are kind of things to be careful about. So I'm very hesitant to tell people you should all do Kegel exercises. I think if you start having, issues like you're starting to feel a bulge in the vagina, or you're starting to feel like maybe you're not holding your urine as much, then those sorts of things you can go see your urologist about and see if maybe Kegels are the right thing for you. But a lot of times, you have to be careful, like to do them correctly and to make sure you're giving that time to relax. But a lot of people don't do them correctly. And that's kind of a problem. One is, if you do them, you need to strengthen and make sure you're strengthening, actually doing it correctly. And then you need to relax, because if you don't relax, some people just do a Kegel and then keep doing them. And they never take 5 seconds in between to relax. Just like when you're in the gym, right? You do sets and then you relax. It's important for your muscles to keep being coordinated and get that rest time. Otherwise, you can develop pelvic floor dysfunction, even if you didn't have it before. If you're having any recurrent urinary tract infections or symptoms like that, or if you're having pain with sex, or if you're having constipation, these sorts of things may be a sign that you have some pelvic floor dysfunction, and doing Kegels will make it worse. So if you are dealing with like really those sorts of symptoms, or like chronic lower back pain, but you've never had an injury or other causes for it, I might see a urologist and get an exam to make sure that that's the right thing for you.
Thank you for tuning in to Self-Helpless. You can find our brand new merch, Patreon community, and other fun goodies at selfhelplesspodcast.com. We'd be thrilled if you left an Apple Podcast review, shared this episode with a friend, or post about it on Instagram and tag us at Self-Helpless Podcast so we could repost you and say hi. As an independently produced show, we sincerely appreciate your support. Thanks, everybody.